Hi everyone, welcome to the very first video of this channel. Before we get into the real content, you know what? Let me quickly introduce myself and why I have started this space. Yes, so this video is going to be a short introduction about myself and what we are planning to do on this channel. My name is Dr. Tomson. I am a doctor in natural medicine. After getting graduated from India, I have been working in the luxury wellness hospitality industry for the past 8 to 9 years. I have had the privilege to work in some of the beautiful destinations across Southeast Asia, including Singapore, Thailand, the Maldives, and currently based in Vietnam for the past 2 years. And as I started with this luxury health and wellness industry, one of my key responsibilities were to curate wellness experiences in a way that is very simple yet effective and can be applied on our daily lives. And you know what I enjoy the most? To make these contents in very simpler terms. And that is exactly what I am planning to deliver through this channel. Make health and wellness contents in a very simpler terms, yet scientifically backed, so that it is easy for you to understand and apply into your daily lives. Hey, let me give you an example of understanding why knowing the scientific backing in simpler terms, if you're not from a medical background, of course, is important, and how it can enhance your curiosity and how it can actually make the practice much better. One of the most highly demanded topics on which I have delivered a number of sessions is breathwork. And during my breathwork class, I usually teach something called as alternate nostril breathing. If you know, you know. If you don't worry. We'll be covering alternate nostril breathing in our future videos. Many of my guests, when they come for this class, they have already tried alternate nostril breathing. But then when I ask them, why should you breathe through your alternate nostrils, or why are you practicing that on a daily basis, they are a little clueless. They don't know why should you breathe through your alternate nostrils. Some of them say, yeah, my breathwork teacher asked me to do so, saying that it will stimulate your right and left hemispheres of the brain. Some of them say that, yeah, it is a good practice to calm down your mind. Yes, these all are true. But then, how is this getting possible? That is where we have to look into a little bit of the scientific background of it. So scientific studies have proven that when you are closing your right nostril and breathing in and out through your left, it can stimulate something called as parasympathetic nervous system in your body. Don't get intimidated. If this parasympathetic nervous system is getting stimulated, it can actually calm down or reduce all your body functions. On the other side, if you are breathing through your right nostril, closing your left, if you're breathing through your right nostril, scientifically proven that it can stimulate something called as sympathetic nervous system in your body. And when sympathetic nervous system is getting stimulated, it can increase or enhance all the body functions. Now you should be getting an idea on what would be happening when you are breathing through your alternate nostrils. We are trying to bring a balance between this right and left, or the parasympathetic and sympathetic nervous system in your body. We don't want anything to be too much higher. We don't want anything to be too much lower. We want a balanced state in our body. And that is what we are achieving when we are doing alternate nostril breathing. Again, if I want to give an example of what would be happening if you close your left nostril and breathe in and out through your right, as I told you, it can stimulate your sympathetic nervous system. So consider you are breathing through your right, it can stimulate your blood pressure, it can stimulate your metabolism. So if you are teaching right nostril breathing to somebody who is already hypertensive, that would work in a negative way for that person. Whereas if somebody is having a low blood pressure and you're teaching them to do left nostril breathing, only left. I'm not speaking about alternate, yeah? I'm speaking about left nostril breathing. That would do bad for that person. Now, that would have answered your question on why alternate nostril breathing is one of the most widely practiced breathing exercise. Because when you're teaching a group class, you don't know if you have got hypos or hypos in the group. Regardless of knowing this, alternate nostril breathing, anybody can practice. Because you're trying to bring a balance, and hence it is widely being practiced and taught. Now, the immediate next question you would ask is, say, if I am hypertensive, as I told you, closing right nostril, breathing in and out through your left can stimulate parasympathetic nervous system. And parasympathetic nervous system, we just learned that it can reduce or calm down the body functions. Can a left nostril breathing be practiced to make my hypertension better? Yes, you can do that as a therapeutic exercise. But before you get into any such practices, I would highly recommend you to get a consultation done with a good expert so that they can do a proper consultation and analysis of any other underlying condition that should be given much more importance or should be addressed before you address your hypertension. So get that consultation done before you get into any therapeutic practices. Otherwise, alternate nostril breathing is a good exercise for you to practice. And usually when this explanation is given, I see that people get more confident, more curious, and they get more interested in these health and wellness practices. So if you are interested in health and wellness, join me on this journey. Do consider subscribing to this channel so that you get notified whenever a new content is posted. Also, share it to your friends and relatives who are also interested in these kind of topics, who could potentially be a part of our journey. Once again, thank you for watching and see you in the next one.